So if you have to measure is lupus causing trouble during pregnancy, you have to know what happens during a normal pregnancy so that you don't incorrectly attribute a complaint to lupus and treat something incorrectly, or mistakenly not treat it for lupus and miss an opportunity to improve the mother's health. So in the next few slides, you will see each organ system and what would happen if they have lupus and what might happen as a normal change in pregnancy. So the first symptom would be skin. In a normal pregnancy, you can have hyperpigmentation of the face, which is called chloasma, and you don't want to confuse that with the lupus rash called a malar rash. In normal pregnancy, you can have a lot of aching in your joints and actually have swollen knees, but that is not true arthritis, and you wouldn't want to mistake that for active lupus. When you're pregnant, your heart rate goes up, your blood pressure goes down, and you might actually have a heart murmur, and you don't want to misinterpret that as having a heart problem related to lupus, and the most common one would be pericarditis. Your kidney function also changes. Your creatinine clearance increases, your BUN decreases, your serum creatinine decreases, and you might actually spill more protein in your urine. All of those things are normal in pregnancy. But if you're going to have renal disease in pregnancy, the protein leak or proteinuria is much greater, and there are other things that you can see in the urine that signify that the kidney may be inflamed. Women who are pregnant frequently complain about being short of breath or that they're hyperventilating. That's normal. That's not the same thing as pleuritic chest pain. So you really have to drill down and sort out what the chest complaint or breathing complaint is. Women with lupus frequently have anemia, but when they're pregnant, you normally can have a low blood count. Your platelet count can go down, but the white blood cells can go up. But if you're sick from lupus, all of those things are very, very abnormal. So you don't want to chase after minor abnormalities. You need to make sure that they're significant and attributed to lupus. Some things that you can measure in the blood that could be markers of lupus activity also change just because you're pregnant. In this case, the sedimentation rate goes up, complement levels go up. But if you're sick from lupus, your complement levels stay the same or go down. That would indicate that maybe the lupus is active, and you might be making more of those bad antibodies, and in this case, double-stranded DNA. So you need to look at the pattern, and you need to follow things over time to see which change the direction is going and the extent of the direction of change. I think every pregnant woman says, I'm tired, and lupus patients say the same thing too, and they may also have a low-grade fever, but you want to make sure that they're not infected. It'd be very important to treat infection if you had lupus, especially with the medicines that we need to control the disease. We want to talk specifically about some things related to renal disease because that's what our patient today has, and to emphasize the importance of why we need to take care of that problem before she gets pregnant. On this slide, we show the relationship of the protein leak that might be present when a woman is pregnant and how that relates to the baby's birth weight. So on the x-axis, you see increasing baby weight, and on the y-axis, you see increasing protein leak. And when you have a lot of protein being leaked out in the urine, the baby is smaller and born earlier. And so what you want to do is make sure you take care of that problem and get it as good as you can or minimize this protein leak before the woman gets pregnant. Because you can see, even if everything else is the same, if the protein leak is of a sufficient value or level, even if the lupus is quiet, it could still compromise the baby's outcome. And to help you with some specific parameters related to the kidney, you want to have an inactive sediment. So that means you don't find any extra elements in the urine when you examine it. You want the blood level of kidney function to be below a certain level, indicating that the kidney is functioning to a certain extent so that it could handle the stress of pregnancy even if the lupus is quiet. And the creatinine clearance is a combination of urine and blood tests that also are another way of measuring how good the kidney is functioning. And we talked about protein leak, so it needs to be below 3 grams, and we'd like it even lower than that if we could. And blood pressure is also an element that needs to be controlled. And as we'll see later, that might involve some change in medications, because things that we might use when you're not pregnant to control blood pressure would not be acceptable when you're pregnant. The last part that I want to talk about that focuses on renal disease is trying to sort out if the kidney is becoming active again, and that's what we're talking about here when we talk about active lupus, versus a pregnancy-related complication called preeclampsia. And if you look down the list of the different manifestations of the things that we would measure to try to sort this out, is it lupus kidney disease or this preeclampsia, you'll see that there's a positive response in almost every box, and there's a grade of how positive it is. And it might be very difficult to sort these things out. And it's actually very important because the treatment would be very different. If you had active lupus, you would be working with lupus medications. If it's preeclampsia and the pregnancy problem, you would opt for delivery. So the treatment's totally different, and so you have to do your best to try to sort that out. And where you might have your best clues would be those serologic markers, the complement and the DNA antibodies. So those things should be either normal or unchanged or increasing, which would tell you that those are normal, that's the normal pregnancy, and they're not in the direction that would make you worry that the lupus was active. To make sure that we keep the lupus disease under control, these are some suggested parameters for monitoring during pregnancy when a woman has lupus. So you'd want to see the woman at least once every trimester. You would evaluate her with using one of the revised disease activity scales, which account for the pregnancy-related problems that we talked about before. You would be examining her and checking her blood pressure and looking at all of the different organ systems. And you would be doing a laboratory assessment, assessing the kidney function, blood counts, and the lupus serologies. As we've been going through all of these different questions that the patients have, I've mentioned that we need to use medications. So every woman is going to say, I don't want to take any medicine, or I'm worried about medications. So I think we should focus specifically on what you can and can't take when you're pregnant and you also have lupus. So when you're counseling somebody with their medication use prior to and during pregnancy, these are some guidelines for how to think about these medications. So in this case, glucocorticoids, which I've also listed as corticosteroids here on this slide, you would need to use those, but you try to use the lowest effective dose to minimize toxicity to the mother and any potential problem to the baby. And we'll talk about that in just a moment. The nonsteroidal anti-inflammatory drugs and aspirin are the next category. And for the nonsteroidal anti-inflammatory drugs, you would discontinue them when the woman becomes pregnant. But if the woman needs to take low-dose aspirin for medical indications, that would be safe. When we use immunosuppressive drugs, there are some that we can use and some that we can't use while you're pregnant. Azathioprine, cyclophosphamide, and sulfasalazine can be continued if it's medically indicated to control the lupus. But methotrexate, cyclophosphamide, mycophenolate mofetil, and leflunomide need to be discontinued. We talked earlier about the importance of keeping someone on hydroxychloroquine or Plaquenil during pregnancy, where we saw that the mother had much less disease activity and the baby outcomes were better. So in almost all circumstances, we would continue to take that medication. But if the woman opted to say, I did not want to take it or I want to be on something else, you would have to discontinue it at least 3 months and maybe 6 months prior to attempting conception, because the medication will still be in your system, and we would want to have enough time to make sure that whatever other medicine we chose was doing an adequate job and you were not flaring on the new medication choice. Some women need to be on blood thinner medications, and in this case it's warfarin. That is toxic to the baby, and you would have to switch to a different kind of a blood thinner medication, which is injectable form of either heparin or low molecular weight heparin. And you have to review all the medications and supplements that the woman is taking, some of which can be adjusted, but some may also need to be discontinued. And probably the most important one here is the blood pressure medicine that we use to treat the blood pressure or the kidney disease. In this case, that ACE inhibitor, and that's toxic to the baby, and I'll show you why that's a problem. So you have to switch medication in that case if the blood pressure needs to be controlled. And you should look at all the medications that the woman is taking, if she needs something for seizures or antidepressants. Bisphosphonates would be a medication for bone health. And if they needed the lipid-lowering or cholesterol medication called statins, you would want to make sure that all of that was evaluated and adjusted as needed. And we'll talk about some of these specific medications in just a moment. And don't lose this opportunity to tell the woman to stop smoking. In many of the lupus cohorts, still 10% of the women admit that they're smoking. And so this is also another opportunity to try to counsel and adjust lifestyle habits.